All right. So good morning again. So in the last class, we have seen regarding the extraocular muscles. Okay, so what do they do? And also we have seen regarding the eyelids. Okay, the eyelid, the opening of the eyelid, it's by levator palpebrae superioris, and the closure is by the orbicularis oculi. Okay, the nerve supply for both of them, the levator palpebrae superioris is supplied by the third cranial nerve, which is the oculomotor nerve, and the orbicularis oculi, it's the muscle is supplied by the seventh cranial nerve, which is the facial nerve. Okay, so this is the anatomical section of eyelid. Okay, you need not remember much, but remember that the eyelid has got a large number of glands. Okay, so you can see many glands. So there is tarsal glands. Okay, so there is lacrimal, accessory lacrimal glands. Okay, glands of Zeiss, glands of mole. Okay, so there are lots of glands. Okay, which keep the eyelid moist. Okay, so there are so many glands to keep it moist. Okay, preventing dryness. Okay, and if there is any infection in these glands, okay, so any infection of these glands, so they will cause swelling in the eyelid like this. Okay, so swelling in the eyelid. Okay, so there are different names for it. You need not know it. It's called as a sty in layman terms. Okay, some of you must have heard. It's called a sty. Okay, so which means the inflammation of the glands which are present in the eyelids. Okay, coming to the lacrimal gland. What is the lacrimal gland? This is a gland which is present on the lateral aspect of the eye. Okay, it is present in the lateral aspect of the eye. Okay, so here you can see the lacrimal gland. This is the medial aspect, and here you can see the nose. So the lacrimal gland, it's also called as the tear gland. Okay, it is the one which is helpful in production of the tears. Okay, now if you see the tears are produced continuously. Okay, so they are produced continuously. Okay, so don't think that the tears come out only when a person is emotional. Okay, so it comes even when a person is normal. It secretes continuously. So why this is secreted? It is the tear gland is very important. The secretions of the tears are the ones which keeps the eye clean so that the vision is clear. So imagine the cornea. Okay, the cornea, this is the part where we receive the images. It's like a transparent structure, just like a glass. Okay, and it needs to be cleaned. So each time we blink, okay, each time we blink, what happens? The tear is secreted and then it cleans the cornea. Okay, not only it cleans, the tears also provide the nourishment for the cornea because this part is transparent. Okay, which means it's transparent. It does not have any blood vessels. Okay, but still this is a living structure. Okay, the cornea is a living structure. Okay, so where does it get its nourishment? It gets its nourishment via the tears. So that's why if you see, like, you cannot keep the eyes open for a long time. Okay, you need to blink your eyes. You cannot keep your eyes open for a long time. Okay, because it needs nourishment and there will be dryness of the eye. Okay, so if you keep it for a long time open, okay, without blinking, so what happens? The conjunctiva, the part which is present over the eye, it gets dried up with the air and then the eye starts paining. Okay, so in order to prevent that, the tear secretes continuously. So what happens to this tears after it cleans the eyeball? Okay, so what happens? The tears, they go through the small openings, okay, which is present on the medial side, and then it enters into a sac which is called as the lacrimal sac. Okay, it enters into a sac which is called as the lacrimal sac, and lacrimal sac, it enters into a tube or a duct which is called as nasolacrimal duct. Okay, now have you heard this nasolacrimal duct before? It is the one
Yeah.
which opens into the inferior nasal concha. Okay, below the inferior nasal concha, which is the inferior nasal meatus. Okay, so when in the respiratory system, when we are talking about it in the respiratory system, I have told you, right, whenever there is a stuffy nose, there will be automatically tears coming out from the eyes. Okay, if you have catch a common cold or a stuffy nose, so what happens? You cannot breathe. Okay, so the mucus blocks the inferior meatus, and when it blocks the inferior meatus, the tear which is normally secreted comes out, cannot come out. It gets collected in the lacrimal sac, and then it comes out of the eye. Okay, so even though the person doesn't cry, it appears like as if they are crying. Okay, so that's the drainage of the tears. So it's secreted from the lacrimal gland, and it goes through the medial aspect of the eye into the lacrimal sac and then into the nasolacrimal duct, which opens into the inferior nasal meatus. Okay, inferior nasal meatus. What happens when a person cries? Okay, when a person cries, the lacrimal gland is stimulated more. Okay, the lacrimal gland is stimulated more. So when it gets stimulated more, what will happen? More tears will be secreted. Okay, and when more tears are being secreted, there is not in this punctum, this small opening on the medial aspect of the eye is very small. Okay, so all the tears cannot come out through this drainage. Okay, it cannot go through this drainage, so it comes out. Okay, as tears. Okay, it comes out as tears. All right, so this is the normal process of lacrimal gland. Okay, so where they are secreted. Okay, and how the lacrimal gland, the secretions are sent into the nose. Okay, what is the link between the eye and the nose? Any doubts? All right,
No, doc.
the next one is the orbit. Okay, the orbit. Orbit, this is the place where the eyeball is present. Okay, the eyeball is present. Okay, so this is the orbit. Okay, the orbit. It is, if you see, it looks like a pyramid. Okay, the apex of the pyramid is here. Okay, and this is the base of the pyramid. It roughly looks like a square shape. Okay, or a spherical shape. Okay, and this is the apex of the orbit. And what are the bones which forms the orbit? So on the roof of the orbit, it is the frontal bone. Laterally, it is by the zygomatic bone. Laterally, also near the apex, it is by the sphenoid bone. The floor is formed by the maxillary bone, and the medial side, it is formed by the ethmoid. And here you can see this is the lacrimal bone. Okay, I didn't mention it. Okay, forget about it. This is the lacrimal. This is the nasal bone, lacrimal bone, and ethmoidal bone. Okay, so the roof is frontal, zygomatic, sphenoid, maxilla, ethmoidal. All right. So these are the bones which form the orbit. Okay, so the orbit is not formed by a single bone; it's by multiple bones. Okay, and here you can see there is an opening on the medial side for the nasolacrimal duct to pass through, and that's called as nasolacrimal canal. If you see near the apex of the orbit, there is an opening. Okay, and this opening is called as optic canal. Okay, This is connected towards the middle cranial fossa. So that's a part inside the skull. Okay, inside the skull. And what are the structures which passes through this? Optic nerve and ophthalmic artery. Optic nerve is which cranial nerve? It is the second cranial nerve. Okay, the second cranial nerve and an artery which supplies the eyeball, ophthalmic artery. So these two structures will be passing through the optic canal. Optic nerve is responsible for vision. Okay, it is the one which is responsible for the vision, the one which comes out of the retina. Coming to the blood vessels. So here you can see this is the optic nerve. Okay, the optic nerve which is coming from the eyeball, and if you see inside this optic nerve there is a small opening. This small opening is nothing but the ophthalmic artery. Okay, the ophthalmic artery. So here you can see the optic nerve. So this is the eyeball. Okay, this is the lacrimal gland. Okay, so mainly in this picture you need to remember the optic nerve and the ophthalmic artery. Okay, the ophthalmic artery. Okay, the others are not reader. Okay, and if you see there is another one which is called a central retinal artery. Okay, the central retinal artery. So this is an artery which goes inside the eyeball. Okay, and you can even see this artery, okay, through a special instrument when you look into the eyes. Okay, you must have seen some doctors, they look into the eyes, okay, with a special instrument. It's called as ophthalmoscope, like a stethoscope. Stethoscope is used for listening to the heart. Okay, ophthalmoscope, it's an instrument to see inside the eye, especially the retina. Okay, and they look into this artery. See, normally you cannot see the arteries because they are covered by the skin, but this is an artery which you can see it. Okay, through the eyes. Okay, through the cornea. Okay, so you can see it inside. Okay, and you can see like how is this artery, and based on the artery you can say like what this person has, whether this person is having any disease or not. Okay, all right, so optic nerve which carry the visual impulses, ophthalmic artery and central retinal artery. And these are the ophthalmic veins. Okay, so there are many ophthalmic veins, and you can see that most of these ophthalmic veins go and drain into the cavernous sinus and pterygoid plexus. Okay, pterygoid plexus. So they go and drain into the cavernous sinus and pterygoid plexus of veins. Okay, the ophthalmic veins. All right, so that's it regarding the orbit. Any doubts? Any doubts?
No,
No,
doctor.
doctor.
No.
All right. Okay, so now we will go on to the next part,